Today I wanted to do something a little bit different. I wanted to talk to you about seasonal affective disorder and depression. I work with people all the time suffering from depression, but it's usually during this time of year that people come to me and they say that they've been feeling more blue, more depressed, sad, isolated from others, and also feeling stress during this season. People will start to experience increased levels of depression, isolatedness, withdrawn feelings during the fall and winter months. Now, why does this happen? Well, as we go through the seasons of the years, the length of the day gets longer and shorter. June 22nd, June 21st, we have perhaps the longest day of the year with the most sunlight. And as we continue through the seasons, as we get toward August, September, October, November, we get to, in December 22nd, the shortest day of the year. Now that's important because in the shortest days of the year, around the fall and the winter months, you're getting very little light. And light is very important to our sleep-wake cycles. It's also very important to our mood. And so it's during these months that people will report feeling more blue and more withdrawn and isolated. And so we actually will diagnose it as either a major depression or some kind of subclinical depression. But how do you know that you're feeling these things in case you don't? You might be feeling depressed most of the day, feeling hopeless, worthless, low energy, having trouble sleeping. In the winter months, people tend to oversleep if they're feeling depressed. And actually in the summer months, in the summer seasonal affective disorder, by the way, they might actually be experiencing more insomnia. Something you might not know about seasonal depression is that it's very common, affecting over 3 million people yearly across the United States. It's more common in women, people between the ages of 15 and 55, and people living far from the equator or in regions of the world where there's less light. It takes more than one season to diagnose seasonal depression, and treatment can include psychotherapy, medication, and light therapy. For some people, seasonal affective disorder comes during other seasons, such as summer. Now, how do you know when you need to see a doctor? When you're affected to the point where you're not able to get certain things done, you're having trouble getting up in the morning, you're having trouble completing assignments, focusing and concentrating, or when you're more isolated to the point where others are saying to you, what's going on and wondering what's going on. That's a good time to think about talking to someone else, going to seek a professional. And many people actually do go to their general practitioner first, who may do the regular blood test and medical test just to make sure everything's fine. And then they usually will recommend you come to someone like me, a psychologist, to really ask more in-depth questions about what you're feeling, what you're thinking, what's going on. Now, when you go to the doctor, some of the things that you can expect they're going to ask you about are your symptoms. They're going to ask you about what you're feeling, how long you sleep, how long or how short, whether you've lost any weight, whether you've gained any weight, any differences or changes in your activity level, any feelings of irritability or irritation when around other people, avoiding going to places like the mall or public places, sensitivity to light. They'll also ask you whether you're taking any medications. They'll ask you when your last checkup was. And they'll also want to look at, if you're doing a blood test with you, as to whether there's anything going on in your body that is noteworthy. And if all medical tests are clear, then again, they send you on to someone like me who will then ask you more questions about psychologically what you're thinking, what you're feeling, and what's going on. And that's what we call a psychological evaluation. And during the psychological evaluation, we'll ask you information about your personal history, your family history, whether anybody in your family has suffered from depression. There's usually a correlation between having family members that have had depression or anxiety and people who are suffering from it. So those are things that are good to know. So let's get into some of the different therapies. If you're going to go see a psychiatrist, they of course will prescribe you medication. I'm a psychologist, so I'm going to focus more on what a psychologist would do as a matter of form of treatment. And well, again, I've started to talk about that a little bit, but what we want to do when you're in psychological treatment or psychotherapy is work on more adaptive ways to cope with your anxiety, with your depression rather, more, and we'll also examine ways of thinking. And I want to get into that a little bit, because what you tell yourself, what you're thinking on a daily basis about your situation, about your life, has a great power over what you're going to feel. So if you have what we call in cognitive therapy negative thoughts or beliefs are the kind of things that you're telling yourself on a regular basis that may be making you feel not so good, that may make you keep from doing things that you might otherwise enjoy. And the purpose of cognitive therapy is to really get into those thoughts and try to help rewrite that script. And what we do is we really try to help people develop more healthy scripts internally so that they can actually live a more adaptive life. We may also do all the kinds of therapy, which I like to do, which is stress management or energy management therapies, where we focus on helping you relax and focus on your body and really work on feeling better and having more adaptive thinking processes so that you can actually feel better in your everyday life. And I also like to get into more behavioral things that you can do to change your environment, to affect your environment, such as getting outside more. Think of it. Think of how often you actually go outside just to be outside. And I don't mean just to commute or go to wherever it is that you're supposed to be, but I mean to actually just be outside.
The main reason I suggest for getting outside is to get yourself exposed to some light. Light helps to regulate the natural rhythms of the body, our sleep-wake cycles, hormonal release, body temperature, our much-needed immune system, and lack of light can affect our physical health. And getting outside affects our circadian rhythms, which is a physical mental process within the body that occurs on a 24-hour cycle, responding primarily to the amount of light we get. To make it simple, light helps to regulate our natural timekeeper, our circadian rhythms. Light therapy is a specific clinical approach and therapy used to help people suffering from seasonal affective depression. And it's the use of a light box to provide additional light for people suffering.
I also want you to do when you go outside is to really take in some air, because oxygen, readily available and free to all of us, is in great abundance outside, more so than in stuffy homes. And again, think about this. How often do we go outside? I know many of us think about that. We go outside, let me get some air. But this too is very important. These are free, holistic, you don't need a professional to prescribe them, methods to affect your mood. Get outside, get some air, walk around, get some light. Even though the days are short, there's a certain amount of light that we need that affects our body, that if we get it, we're going to feel better.
So while it is very important during the course of the day to expose yourself to as much natural light as possible, at night it is very important to actually reduce the amount of exposure to artificial light. Artificial light given to a person close to the time of sleep can affect our sleep-wake cycles. It's important to actually shut those lights off close to the time of sleep so that we don't affect the quality of our sleep and end up tired and lethargic the day afterwards.
I believe personally that a lot of the depression, anxiety, and the illnesses that we experience in life are happening because we're actually living lives that are not necessarily natural compared to what it was a few thousand years ago when we were roaming and we were walking around and we were hunting and gathering. We are sitting in offices or we were sitting in homes all day long, sedentary, artificial light, not enough movement, not enough air, not enough water, and then you wonder why you're feeling the way you do. A lot of the materials that we're putting in our bodies are not natural. And because they're not natural, they're causing our body to have to process them and do extra things, and that too can have an effect on mood. We're also not getting enough of the nutrients that we should get from a more holistic and natural diet. A lot of artificial stuff, but not enough of the natural stuff. So supplements, I don't want to get into any specifics, but some of the supplements that are on the market are great things to put in your body. But you know what? Back to the basics, fruits and vegetables. I'm adding to it light, air, water, exercise, moving around. These things can affect you.
We've left the studio and now we're headed to the office of a psychotherapist to talk about the treatment of seasonal affective disorder through psychotherapy. I'm joined by Tram Hoon, who's a psychotherapist at the Center for Optimal Performance.
Yeah, so we're here to talk about the tools and techniques that I use here in this office, helping clients overcome depression and how to help them have a more normal daily routine. Yeah, so I have quite a number of clients coming here, and they want help with ways to help them overcome depression, how to really wake up and feel better, how to overcome depression and anxiety. So I have a lot of those cases. Right. Even though depression is a prevalent problem for many people, they still experience it very differently. It's a unique experience. So there's no there's no one size fits all. The first thing I do is to really understand the experience. What do they define as depression? Some people report feeling irritable when they wake up. They feel angry. They feel irritated easily. That's what I hear among many male clients. Whereas female clients, they report feeling guilty. They feel less worthy. They feel ashamed. So I see differences when it comes to depression between the two genders. So what I do is I try to understand how they go about their daily life when they feel depressed. Many of them have no direction when they wake up. They don't know what to do with their day. They feel hopeless. They feel lack of energy. So I help them set some goals, like very manageable goals, so that they feel accomplished, such as they shower in the morning, they have breakfast, they do grocery shopping, and they prepare a meal for themselves. They make one phone call to a friend or a family member. So that's maybe good enough for them. So they feel accomplished, they feel they have a purpose. And other people, I also encourage them to be more active. So we work mind and body. So this is the body part. I want them to be more active. So they can either meditate, they can do yoga if they prefer yoga, or they can go for a walk, going for a run. So that's working on that, the body part of it, really to manage stress. Stress management is very important when it comes to dealing with depression. Okay. So besides, setting goals and managing stress, I also encourage clients to be more social, even though it can be a daunting task, because most of them feel lonely, they feel isolated. So it really takes a lot of effort for them to go out and reach out to people, but that's very essential. Social, it doesn't mean that you have to be in a group of 10 people. That's not helpful when you're feeling depressed. It's really about talking to somebody you really care about, who cares about you, being out there rather than being at home feeling hopeless and depressed. Call a friend that you know would say nice things to you. Call a family member, your parent, your sibling, and talk to them. Talk about things that you would not usually talk with coworkers or with people, that you meet on a daily basis. If you are a single, it's important that you reach out to your support system and really make use of it.
Okay. What can be said to people who may not have much of a support system? Maybe they have very few friends or not necessarily have coworkers that they can go to.
Sure. So this is where therapy is very helpful. They come to see a therapist who is a person who cares about them, who understands what they're going through, and maybe can help them see things differently. So that's something I also would, assist.
So you advocate therapy as a means for people who may not have other resources to connect to and be social, as a way to actually find a person that they can talk to that is actually trained to listen to them.
And who is available, who is emotionally connected with them. I also run groups for people who suffer from anxiety, from loneliness, so they come and share their experiences, share some of their problems, and it's nice to have support, to feel that they're not alone. It's not just them feeling depressed, alone, and lonely. People have that too. Even though we live in a big city, many people report having, those problems. And another thing that I would also suggest clients to work on is what we call cognitive therapy. So we really work with the mind at this point, really repattern their thinking. What I have seen among depressed clients is that they have, we call them distortion. They see life through a lens of distortion. Things have to be this way. It must be this way. It's very rigid. It's very strict. They feel obliged to do many things that they may or may not want to. They just feel obligations and forced to do certain things. So I try to expand their views. So I want them to think of things in a more permissive way. I would like to exercise more. I would like to go out and explore new things. I would like to try new activities and see how that feels like. So I work with a cognitive thinking, and also maybe be more creative, use their creativity to understand how can I interpret that in a different way that is not critical. Maybe she didn't criticize me. Maybe I felt criticized, that she was trying to make me aware of certain things. What might she be thinking? What might she be intending with that phrase, with that language? So really expand their mind, expand their way of thinking, and look at things more from a more positive lens. So we call it positive psychology. What can you be grateful about? So shift their mind from something that's not working to something that they're grateful for. I am grateful for my job, for having a family that loves me, for living in a place where I have access to food. I have a client who just came back from Africa. There was zero food, there was no water. She was suffering for 3 weeks. Now she comes back and realized I have food everywhere. I didn't know this. I was so privileged and I was not aware that I was so lucky. Mm-hmm. So really put things in perspective. I use different approach with different people, but I do look at mind and body. I integrate the two. All the techniques I use would be looking at how they think about life, how they think about themselves and other people, and how they take care of their body. Okay, so when I integrate body and mind in my approach.
Okay. And so, as a bullet, what are the 4 things?
Yeah. So when it comes to mind, I use cognitive behavior therapy. I look at how they can repattern their thinking so that they can recreate some behaviors, and that makes them feel different about themselves, feel better. The second thing is also setting goals. Really, when you feel hopeless, it's important that you set some goals that you can achieve so that you feel more accomplished, more successful. The third thing would be really about being active. So stress management is very important as well. That's the third thing. And then being social, that's the interpersonal aspect of it. Reaching out to other people, being active socially so that you also can feel less lonely, feel more connected with people. That would make you feel better.
So one thing that I might suggest for beating the blues that are inevitable during the winter season is setting realistic expectations for yourself and for others about what you might get accomplished. Paying attention to setting boundaries for what is feasible for you to do. Is it realistic for you to go out on the weekends instead of staying in? Do you want to spend more time with family or friends? Have you allotted time for that? Another thing might be, maybe you want to do an extra yoga class. You want to spend a little bit more time, focusing on your physical activity. A lot of times that helps to calm people down and relieve anxiety. The other thing that you might think about is, are you engaging in a lot of negative self-talk? For instance, I didn't go get all my holiday shopping done on time. Well, maybe that's okay. And maybe a lovely note that you write someone will be just as well received as, a boxed gift. So consider ways to take the pressure off and speak to yourself the way that you might speak to a good friend. And, receive all of the thoughts that you might be having with some gentleness and kindness. And again, that could be, you could be kind to yourself regarding, setting goals. Again, make sure that you're um, doing things within reason, that you're not stretching yourself too thin. And if you need space for yourself from other people, make sure that you get a little bit of space that you need. The other thing I think that might be helpful regarding the blues during the winter is, keeping a list of things that you've done already versus things that you have to do. So a done list versus a to-do list. People have long lists of things that they need to do, and that can seem so overwhelming. And they forget about all the great things they've done throughout the year. And oftentimes looking back at that list and thinking about all of the wonderful career or personal accomplishments, for instance, spending extra time with a close friend, or getting a chance to read a book you've always wanted to read. Those things are wonderful accomplishments, and you should take a moment to feel, happy that you've done those things versus being stressed out about things that you haven't yet done. Going into, family settings can cause a lot of stress, especially if you're, revisiting old arguments, or if you're in a stressful situation interpersonally. I think awareness is a very big thing when it comes to interpersonal relationships. So being aware that someone makes you, feel a certain way can, if you already know that you might feel that way, then you can prepare for that before you go into the dinner or before you go into the weekend with your family. And allowing that those things might happen, and taking more time to sort of prepare for that. When you're going into difficult situations sometimes, I think that if you've already gotten into the habit of being a little kind to yourself, forgiving yourself, and opening up that space for the possibility that things might be okay, then you might then offer that same kindness to someone else. So walking into that stressful dinner, or that stressful meeting, or that stressful family weekend, and you've already spent time being good to yourself. That previous week, for instance, you spent an extra, few hours meditating, or you went to the gym, or you read a book that you liked. You took some time for yourself. Then it might be easier for you to think, well, maybe someone's going through a hard time, so it might be okay to feel a little bit more relaxed about this situation, and that things might go differently, and that you might feel a little bit more patient about it this time. I think therapy is helpful because it's a way for you to get to know yourself better, and to see all the strength that you do have inside of you, and to work with someone who can also see that strength inside of you and can guide you to see it, so that you can shift and change in a way that would make your life better.
What is the role of the therapist?
I think the role of the therapist is I think it's a complex role, and I think that it's also really simple. So I think the role of a therapist is as guide, as someone who sort of gently walks beside you as you go on this path to figuring out who you are and what the world is about and how you fit in. Someone who doesn't judge you as you do that. Someone who walks alongside you and sort of points out the scenery and says, oh, what about this? And what about this? And what do you think? And a person who allows you to really access that stuff inside of you that's going to eventually help you and help you become more of who you are.
when someone's looking for a therapist,
Yeah.
what's important for someone who's looking to find?
When someone's looking
Someone who's looking
find
for
a
a therapist,
therapist.
what's important for them to kind of search for, or an experience that they're looking to have?
When someone's looking for a therapist, I think it is important to search, because I think that the more you spend time with a therapist, you'll get to know what feels comfortable for you. And I think that it's such an intimate kind of setting, and you're sharing such intimate things about yourself with someone, that I think you need to feel really comfortable with this person. But it's more than comfort, it's that you need to be able to be honest with this other person. So much so that you allow them to experience your life with you, so that you can make some kind of change together.
All right, I've taken the advice given during this episode. I've gotten outside. I feel a cool breeze coming across. I can hear the leaves rustling in the background. Seasonal affective disorder is something that affects over 3 million people a year. It is treated by psychotherapy, light therapy, and medication. If you want more information about that, you can go to nih.gov, as well as the Mayo Clinic, from which we got a lot of our information for this episode. Special thanks to the clinicians at the Center for Optimal Performance for coming on and talking to us about therapy, psychotherapy, and what happens in the treatment room. Also, thanks for their tips on healthy living and coping with seasonal depression. Really, the recommendation from us right now is for you to get outside right now, get some air, drink some water, eat healthy, and be well. Thank you for watching.